Professional ethics in nursing exam practice questions. Question 1. A client asks the nurse not to share a diagnosis with visiting relatives. What should the nurse do? Option A. Respect the client's confidentiality. Option B. Tell relatives if they seem concerned. Option C. Post the diagnosis on the door. Option D. Ask another client for advice. The correct answer is option A. Respect the client's confidentiality. Confidentiality protects dignity. Health information belongs to the patient, and trust grows when privacy is treated like a locked medicine cabinet. Question 2. A nurse witnesses a colleague documenting care that was not performed. What is the ethical action? Option A. Ignore it to avoid conflict. Option B. Follow the chain of command and report the concern. Option C. Correct the chart without discussion. Option D. Tell the client to complain online. The correct answer is option B. Follow the chain of command and report the concern. Honest documentation is the heartbeat of safe care. False charting can hide harm, so the nurse must act through proper channels. Question 3. A competent adult refuses a prescribed blood transfusion. Which ethical principle guides the nurse's response? Option A. Autonomy. Option B. Justice. Option C. Paternalism. Option D. Fidelity only. The correct answer is option A. Autonomy. Autonomy means the patient remains captain of personal decisions. Even when the nurse worries, informed refusal must be respected. Question 4. A nurse gives extra attention to a famous patient while delaying care for others. Which ethical principle is threatened? Option A. Justice. Option B. Confidentiality. Option C. Veracity. Option D. Accountability. The correct answer is option A. Justice. Justice asks care to be fair, not flashy. Status should not move one patient's needs ahead of another's clinical priority. Question 5. A client asks, "Am I dying?" The nurse knows the prognosis is poor. Which response reflects veracity and compassion? Option A. No, do not worry about that. Option B. I can stay with you and help you discuss what the provider has explained. Option C. You should not ask difficult questions. Option D. Everyone dies someday. The correct answer is option B. I can stay with you and help you discuss what the provider has explained. Truth needs tenderness. The nurse does not abandon the question or give false comfort, but supports honest conversation within the care team. Question 6. A nurse makes a medication error. Which action demonstrates accountability? Option A. Assess the client and report the error promptly. Option B. Wait to see if symptoms occur. Option C. Document the dose as not given. Option D. Ask a coworker to take responsibility. The correct answer is option A. Assess the client and report the error promptly. Accountability faces the facts quickly. Patient safety comes before embarrassment, and prompt reporting opens the door to treatment and prevention. Question 7. A client wants to see the medical record. What should the nurse do? Option A. Follow facility policy for access to records. Option B. Refuse because records belong only to staff. Option C. Print another client's record as an example. Option D. Allow the client to edit provider notes. The correct answer is option A. Follow facility policy for access to records. Patients have rights to their health information through proper channels. Policy protects access while preserving accuracy and privacy. Question 8. A nurse accepts an expensive gift from a client's family to provide faster care. Which issue is involved? Option A. Boundary violation. Option B. Beneficence only. Option C. Normal gratitude. Option D. Therapeutic silence. The correct answer is option A. Boundary violation. Professional boundaries keep care clean. Gifts tied to special treatment can bend judgment and weaken fairness for every patient. Question 9. A nurse is assigned to care for a client whose beliefs differ from the nurse's. What is the ethical expectation? Option A. Provide respectful, unbiased care. Option B. Request reassignment for all differences. Option C. Challenge the client's beliefs. Option D. Avoid all communication. The correct answer is option A. Provide respectful, unbiased care. Ethics requires care that does not shrink because values differ. Respect turns diversity from a barrier into a bridge. Question 10. A client lacks decision-making capacity and has an advance directive. What should guide care? Option A. The advance directive and legal surrogate process. Option B. The nurse's personal opinion. Option C. The loudest family member's choice. Option D. The fastest treatment available. The correct answer is option A. The advance directive and legal surrogate process. Advance directives carry the patient's voice forward when illness steals speech. They guide care when decisions become cloudy. Question 11. A nurse posts a funny story about a patient without using the name. Why is this still unethical? Option A. Details may identify the client and violate privacy. Option B. Humor is always illegal. Option C. Social media is never used by nurses. Option D. Only photos count as privacy breaches. The correct answer is option A. Details may identify the client and violate privacy. Privacy can be broken by details, not just names. A unique story can point to a real person like a fingerprint in words. Question 12. A nurse promises to return with pain medication and forgets. Which ethical principle is weakened? Option A. Fidelity. Option B. Justice. Option C. Autonomy. Option D. Nonmaleficence only. The correct answer is option A. Fidelity. Fidelity means keeping professional promises. When a nurse says they will return, that promise becomes part of trust. Question 13. A student nurse is unsure how to perform a sterile procedure. What is the ethical action? Option A. Ask for supervision before proceeding. Option B. Pretend confidence and continue. Option C. Let the client teach the skill. Option D. Skip sterile technique to save time. The correct answer is option A. Ask for supervision before proceeding. Competence protects patients. Asking for supervision is not weakness, it is the professional break that prevents harm. Question 14. A nurse sees a coworker speaking harshly to a confused client. What should the nurse do? Option A. Intervene to protect the client and report appropriately. Option B. Assume the coworker is stressed. Option C. Record nothing because no injury occurred. Option D. Tell visitors to handle it. The correct answer is option A. Intervene to protect the client and report appropriately. Advocacy steps between vulnerability and harm. Respectful care is not optional when a patient cannot fully defend themselves. Question 15. A client requests information about a procedure before signing consent. What is the nurse's role? Option A. Ensure the provider gives needed information and witness as policy allows. Option B. Explain every surgical risk independently. Option C. Pressure the client to sign quickly. Option D. Sign consent for the client. The correct answer is option A. Ensure the provider gives needed information and witness as policy allows. Informed consent depends on understanding. The nurse supports the process by protecting the patient's right to ask before agreeing.